Hi, everybody. Good evening. My name is Cynthia Alvarez, and this is the Grand Boulevard Coalition show. This evening, I'll be doing an interview. And if there's any technical difficulties, just forgive us. We're figuring it out. But for now, I just want to introduce our guest for today's show really quick. His name is Bamani, and I was introduced to him by my boss, Miss Laurel, from Chicago Area Project. And so we made the connection and thought it would be really great to have him on and interview him, talk a little bit about community engagement, what that means, what he does related to it, and what work he does for the community too. So yeah, we'll be working on doing that. Can Bamani hear me right now? Let's see if we can try to make contact. Hi, Bamani. I can see you and I can hear you.
I, I technically, I can't. Can you hear me?
I can hear you. Yeah,
Hello?
I can hear you.
Hello?
I can see and I can hear you, but I don't think you can hear me.
Wonderful. Technically, I can't. Can you hear me? Okay, great.
Okay, I think there might be a bit of a delay. Um, I'm not too sure if we're okay to keep going. Um, so we'll just kind of try to go through the first question. Even if there's a little bit of a delay, that's okay. So,
Yeah,
Bamani, share
because,
a little bit about yourself. Where did you go to school and where did you study?
yeah, so I grew up in Chicago, lifelong resident of the city of Chicago, graduated from Tilden High School, spent a little time at Harold Washington College, and then I went on to Northeastern Illinois University for School for Inner City Studies, and study community and economic development. But my studies at Harold Washington was political science. So it's one of my first love is political science. The delay is throwing me off, but I'm gonna work with you. And then I've been a lifelong community organizer. So I've probably have been organizing on various levels in the community for well over now 30 years.
That's awesome. Oh my God. I didn't know that you went to Northeastern Illinois. I also went there and I studied social work there. I think that's really cool. I think we did talk about it actually. We talked a little bit about UIC and Northeastern in a previous conversation. But thank you for sharing a little bit about that and where you study. I think that's really interesting. Political science, you said, which I think is really cool. And you said you've been doing community engagement for a really long time. So tell us a little bit about where you work and what's your current role. What are you doing in that role right now?
Yeah. So currently, right now, I work for a phenomenal organization called Acclivus Inc. It is a non-for-profit organization that uses a public health approach to addressing community violence. We're working in 8 communities across the city of Chicago, Cook County, providing street outreach services and case management to high-risk individuals. I am the current director of community engagement, so um, my role is really to build relationships with community stakeholders, elected officials, policymakers, to ensure that the work, number one, to introduce them to the organization, but also um, to be that bridge between the organization and those community stakeholders so that we're able to do the work at a very high level and in gun violence issues. So at least bring the numbers down in the communities that in which we are working at. And listen, I've been an activist now for 5 years. The CEO Levon Senior is someone um, is subject matter expert who leads the organization with Melody, and, and we've also helped. I will say help build capacity of smaller community-based organizations who are actively engaged working in the community as it relates to violence against.
Nice. Okay. Thank you so much. Yes, I think that that's really important doing a focus on community violence and doing it at a macro level where you said you're working with stakeholders, policymakers. All of that stuff is really, really important. And I think that definitely more people need to pay attention to that because it all really trickles down, right, from policies and laws and the government and what they're doing and how that trickles down into our communities, right? So I think that it's really important the work that you're doing. And it's really interesting, community violence. There's just so much that goes into it. So it's really great that you're making all these connections, right? Because it's, even though you focus on maybe like one community or a couple communities, all of our communities in Chicago are connected and have similar struggles and similar issues, right? And I think that that's really cool that you're working on that. And I think, I'm not sure if you mentioned a little bit about the demographic that you work with specifically in this area. Do you work more with younger people, older people? Who's your focus? And
Yeah,
also, what inspired you
yeah,
to get into
and
this
I'm not
field?
sorry. Yeah, I think. Sorry about the delay to your audience as we're talking. I'm getting on a delay. However, to answer your question specifically, you know, the age runs the gamut. I would say um, anywhere from individuals 13 years old up until 50s or 60s. We work with shooters or anyone who may perceive themselves to be in danger. And the communities that we work in the Douglas community. Working in Grand Boulevard community, working in the Washington Park community, working in Washington Heights, West Pullman, Greater Grand Crossing, Full Park. These are areas that we have sites, and we just now opened a office in Harvey, Illinois. So we also are serving in the southern suburbs, but we also uniquely in our partnership Office of Gun Violence Prevention. We also um, have a peace initiative, better known as a FLIP program, where we work with high-risk individuals and key individuals to help curb violence in some of those communities that I just mentioned. And so the demographics is primarily African American population. There's really no age limit on, who would be necessarily a shooter or in danger of being shot, right? But I also failed to mention, I think the core of the organization is our hospital response team. So we're working in also 6 hospitals across the city of Chicago, providing case management and to help triage situations when individuals are brought into any level 1 trauma center or hospital with a GSW, a gunshot wound, or blunt trauma, or suffering from some level of a violent incident. And so we have case managers, hospital responders on staff on site within that golden hour, which is 1 hour, to be there to assist the hospital in trying to, number one, you know, assess the situation with the patient because the nurses and the doctors there are there to um, get the person healed and patched up, if you will, and on for treatment. There are situations where you may have family members, you may have community people coming to the hospital to check on folks. Then it could really be a situation where it's an ongoing violent incident, and you could even have the perpetrator coming to the hospital to make sure that they're trying to finish whatever they implemented on this individual, right? And
Mm-hmm.
so our hospital responders are people who are credible. messengers, people who are known in the community, and so they're able to kind of triage the situation so that the doctors and the nurses can do what they do, and then we can calm the community and calm the patient. So we're kind of unique. We use a public health approach again, and listen, I the greatest thing about this job is if I could work myself out of it, by working to eradicate and end gun violence and stop it from being a problem that it is in our community. So I think that that's kind of the end goal of this work. And listen, the public health approach, it takes everyone, parents, school teachers, law enforcement, business folks, church people, the religious community. It includes everyone.
Mm-hmm. Yes, that's so true. I think it's really cool. I didn't even know that you guys were also in the hospitals. And I think that that's a really critical point and a critical place to be in right when the violence occurs, right? To be there in the middle of it, and not necessarily in the middle of it, but within seconds after it happens, there's people available that are there to help you, right? And I think that's really great that you make those connections as soon as these things happen, because that's when it's most important to make sure that they do have those connections when they go to the hospitals, that, hey, this person needs help. And more than just the healing part, like you said, right? Healing their wounds, their physical wounds, but there's also mental wounds and things that those doctors can't help them in that immediate moment, right? And I think it's really great that there's case managers in hospitals. I highly, highly, um, go for things like that. And I feel like those things are really, really good to have. I do have a little bit of experience when I was a case manager at a pediatric office, so not necessarily a hospital, but working with kids that are going to the doctors to see a dentist or a doctor for another need, but just trying to figure out what other needs they may have, right? And it's really great when you're able to meet them where they're at in hospitals and places that you can already find them, versus having them try to come to you when maybe things come up. People may be busy in their communities, or just not, being able to go see us, right? To come see us. So I feel like it's really great that you go to them and do things like that. So I think that's really unique, and I think I hope more hospitals are doing that, and making more connections with organizations like this one, Acclivus, to connect people with those kinds of aftercare that they need after their hospital visit. So thank you for sharing that. And I guess if you're able to elaborate a little bit more on what are some successes that you've had in this role, in this field, any specific moments that you were just
Yeah, yeah.
feeling really good about
There's
it.
also a situation where we do patient follow up.
Mm-hmm.
And then more to your specific question about success, I think that the fact that in this space, you I've worked with some folks who are indigenous people, some who are just as impacted, who've changed their lives, and made a commitment to coming back to serve the community, and have been able to be in a space where they're able to do this work. And in some communities that we've gone in, up until um, early of this year, we've actually saw reductions, great reductions in harm and risk, shootings, and murders in some of those communities. So those things I'm most proud of. It's not that I'm necessarily the person, on the streets. I give all the kudos to our outreach workers,
Mm-hmm.
who are out there just like policemen. Not the police in a sense, but there are they're public servants. They put themselves at risk in some cases. I mean, there have been cases where outreach workers have been shot and wounded trying to mediate certain violent incidents. And I will pause and like to give my condolences to the police officer who was murdered the other day in a traffic stop, and something that never should happen. I mean,
Mm-hmm.
there's the fact there are too many guns in the wrong hands on the streets of the city of Chicago. And we have to begin to address the culture that's really permeating throughout our community. And when I say our community, I'm talking about the African American community. This drill culture,
Hmm.
and with this drill music, and many of our young people are really suffering from some really, traumatic, you know, mental health, drug addictions, and I'm not excusing the behavior. Um, However, it's just what it is. And so there are outreach workers every day who are working across this city, not just at Acclivus, and I will say another success story. A part of this is that, we've helped champion funding, violence prevention work. Prior to 2020, there was not a lot of funding for this work. And thankful to the Illinois Legislative Black Caucus, this governor, Governor Pritzker, and then the city of Chicago and President Tony Preckwinkle, the county has increased it, and money for mental health services. I think finally now, more than ever, because our level of advocacy, there are more dollars that are being granted out to community based organizations to provide this work. And we also serve as trainers. So I should say that we train smaller community based organizations on how to provide and do violence prevention work with fidelity. And so we have a very robust, competent um, training team at Acclivus who train community organizations who may apply for money from the Illinois Criminal Justice Information Authority or the Illinois Department of Human Services Office of Gun Violence Prevention. We serve as trainers for many of those groups.
That's awesome. I think it's really important to definitely give kudos to people in power who are supposed to be there to support our communities by giving that funding. And I think it's really interesting what you said about how after 2020, you notice that there's more funding for places, that organizations that offer mental health help, community violence help, and prevention. And it's great to see that they're kind of improving on that and starting to notice that, hey, our communities need more help and more resources that we can offer. And we have the people, we have the power, the resources, the reach, the outreach, and it's just a lot of it that holds us back is, getting the funding and making sure that we're being supported as the workers that are out there in the field by the state, right? And being supported through funding and things like that. And being able to train people, be trained by other organizations, I think is really cool and really important because then you're able to make connections with other organizations that you might not have heard about. And it's just great networking, right? Because then we can refer our people that we come into contact with out in the communities like, hey, we know about another organization that's maybe a little better fit for you or that offers other resources over here. So I think it's really important that you make those connections. And I like a little bit about what you touched on earlier with police and Enrique Martinez, the one police officer that has passed away. I did hear about that as well. And our condolences to his family. And just, realizing that police are also people that were a part of our communities, right? And I just wanted to emphasize that the importance, between trying to better connect our community with our police and making sure that we feel safer with our police, right? Because I know that we have tensions with our police, communities that fight back against, precincts and being built in their communities because they don't trust them, can create, issues with community violence too, right? So it's kind of all connected. But because we are getting close to the end, I just want to ask one last question to you. And what motivates you when you're working in this field if you're facing setbacks or just something that motivates you?
My motivation is getting up every day knowing that I can make a difference, right, in the community and change the trajectory of someone's life. Any young person that I run into, I come from the bowels of the community. Born and raised, on the proverbial low end of Chicago. So I think the fact that I believe that I can still make a difference is what motivates me, and that and if I could help some young person change their trajectory and their path in life and put them on the straight and narrow, I'm all in on it, right?
Mm-hmm.
And my hope and goal every day is to work to create safe, peaceful, economically thriving African American communities. Not that I'm, against anyone else, but I live in an African American community. I've been a part of certainly a marginalized class of individuals, and so having sustainable communities, schools, businesses, and again, economically thriving communities that are crime free. I mean, let's make no mistake about it. The data shows it. 80% of the violence that's perpetrated in this city is coming out of the African American community. And unfortunately, there's data that shows that in Chicago, we have 71 communities. I believe there's 71 communities in the city of Chicago, their neighborhoods, communities as they map them out.
Mm-hmm.
There are only 22 of them that are violent. Unfortunately, 17 of the 22 just happen to be majority African American communities, right? So I think, for me, I'm gonna do all that I can every day that I get up, that I have breath in me, and I'm able-bodied, to go out and try to make a difference in those 17 communities, one of them, or seven of them, or five of them, or one of them. But I am going to be found working to help change the conditions in those communities, and that's kind of what I've been dedicated to, even in my space of organizing. I mean, I'm not satisfied with what I see in the communities. Children being shot, whether it's a child, an adult, or a police officer, is sad. It saddens me, and I know that we can do better. But and again, African American youth have the highest unemployment, in the state of Illinois. We have to change that. So we
Mm-hmm.
have to fight and organize and petition our policymakers and lawmakers, to change that. I equate poverty with violence, right? And when you disinvest in communities for years, these are some of the results. Again,
Mm-hmm.
I'm not making an excuse for bad behavior, but these are the facts that exist.
Mm-hmm.
And a child can't be what they don't see. And it starts, from growing up. And I can go on infinitum, and I know that you're a social worker. I think there need to be parental support programs, to support single moms who are raising high risk boys and individuals in their communities. I do. But we'll come back again, and I think the next time I'm gonna come in the studio.
Yes, I agree. I think that would be best to come to the studio. I appreciate everything that you brought up. I feel like it's all, like you said, it's all connected. Poverty, crime. It's just when you give people very little resources in their own communities, there's very little things for them to do. There's little places to maybe find a job, get money, right? So they look to other places to try to get that money and try to, support themselves, support their families. It's all connected. And I think that is a really good point that you bring that up. And definitely, we would love to have you come into the studio to talk more about this because this topic is so interesting. I do enjoy talking about these things, especially because, being in social work, there's so many different things that affect people's lives. And now more than ever after the election, people's lives are going to be affected in various different ways. And who knows what's going to happen with community violence, right? If it's going to be higher as a result, it's just so many different things that's going to happen. So, and different things that we have to pay attention to, right? So I think that's really important. And you brought up some really, really, really great stuff. I would love to talk about more with you. And definitely we could do like a part 2 to this conversation in person. I apologize to everybody for the delay, but I appreciate Bamani for taking the time to join us and with the technical issues and everything. Thank you for sticking through with it. And for people viewing at home, thank you for also bearing through this with us. I hope you all enjoyed the conversation and are looking forward to maybe another part of this discussion with Bamani. Thank you so much for the work that you do, and we hope to see you again. Thank you to everybody at home. Have a good night, And just a quick shout out to my dad. Happy birthday. It's his birthday today. But I hope you all have a really good night. And thank you so much. Have a good night, everybody. See you next time.